Have you ever wondered what is the shape of the eye and what impact does it have on your vision? Today we are going to be discussing one aspect of it. Hi, I am Dr. Krishna from Pixel Eye Hospital. Have you heard of this term called astigmatism or cylindrical power that is there in spectacles? Well, that is because of the shape of the eye. Now normally eyeball is shaped like a spear, something like a round. Now when the eyeball is not shaped like a spear and it is slightly oval and it is stretched in one particular direction, either horizontally, vertically or in one particular angle, it is called as astigmatism. It induces astigmatism, because of which you require a cylindrical power in the spectacles or the contact lens that you wear. Now what are the causes for this astigmatism to manifest and what all it can do and what are the treatment options that are available at different age groups? Now it is very important to understand cylindrical power or astigmatism, because if a child has cylinder and is not using glasses, the impact of the cylinder on his vision is extremely profound, and because of which they are very much likely to develop a condition called as amblyopia or lazy eyes. So that is why in children it is all the more important to diagnose and fully correct any cylindrical power that a child may have. Now the cylindrical power may manifest as either a plus power or a minus power, whichever is comfortable for the patient while reading. The cylinder is there because the eyeball or some structures of the eye are stretched in a particular direction and they are not able to form an image which is completely correct in all forms of the shape. In a sense, if there is a point source of light, normally we will see it as a point source of light. However, somebody with a cylindrical power, because the structures of the eyes are stretched in a particular direction, they will also form an image which stretches this point of light in a particular direction. So if you are seeing, say, a street light that you have with a halo or a glare which is stretched across in a particular axis, that could be because there is a cylindrical power in your eyes. Now in children, there could be multiple manifestations. It can happen right from the birth or it can present slightly later in life. Now there are multiple reasons why a cylindrical power can come up in a child. For starters, it could be something that is there in the family. Just like the height and the weight and the body build and structures and these things run in the family and they're genetically, because of the genes, they manifest in a certain way. Similarly, the eyeball shape could also be something that many people in the family have, and that is why they develop a cylindrical power and as the eye is growing in its size. The second common reason is whenever there is a delivery, if there is a forceps delivery, there could be some minor trauma which happens to certain layers of the cornea. Now this minor trauma can also manifest as a cylindrical power in a particular axis. In addition to it, as the child grows, there are multiple conditions like keratoconus or keratoglobus, which are basically thinning which are seen in one particular layer of the eye called the cornea. They can also suddenly induce cylindrical power in the eye. So when a child between the age of say 3 years to 15 years is manifesting a cylinder and there is a change in that cylindrical power, one has to check for all these conditions. One is if there are any injuries or trauma marks in the eye as a result of the delivery, and second, if the cylindrical power is something that runs in the family, and third, if it is a cylindrical power that is constantly changing year to year and it is increasing, then one has to rule out conditions like keratoconus or keratoglobus or other diseases which cause a deformation or shape change in the cornea. The second most important part in understanding cylindrical power is the treatment. Many times when children start wearing a cylindrical glass, they are not extremely comfortable and they may have symptoms like they are feeling headache or they are feeling little heavy or nauseatic, and they feel more comfortable when they remove the glasses. However, like I mentioned before, if the cylindrical power is untreated, they are at high risk of developing something called as meridional amblyopia, and This makes the eyes lazy, and even in future when the cylindrical power gets treated by multiple things, the laziness of the eye cannot be reversed. So it's extremely important to get your children checked for different refractive errors, and most important is to rule out if they have a cylindrical power in the eye. Now, once the child becomes older and they are in the age group of beyond 15 to less than 40, the ways in which you can treat the cylindrical power is by glasses. It can also be treated through LASIK, SMILE or PRK, and contact lenses. So these are the treatment modalities which are available to treat an existing cylindrical power. Now, till almost the age of 20-25, keratoconus is a condition which can progress, and hence if it has been diagnosed even in childhood, you have to be regularly getting your eyes checked till the age of 20-25 till the stability of the keratoconus has been manifested. Now there can be adults who have this cylindrical power, and when they are undergoing cataract surgery, there are methods in which you can correct the cylindrical power. So normally in cataract surgery, we have the monofocal lens, the extended depth of focus lens, and the trifocal lens. There are 3 different types. These are all for those eyes who do not have cylindrical power. In case you have cylindrical power and you are undergoing cataract surgery, this can also be corrected through all these lenses. However, they have to be customized according to your power, according to the axis in which you have the power. So currently with the advanced technology, we have custom lenses that we can do as per your eye in any of the 3 categories of lenses that you choose. So these lenses are called as toric lenses. So whenever a person with cylindrical power is undergoing a cataract surgery, then you need to undergo or pick a lens which is having a toric component which is customized for your eye, so that you don't have to use glasses for distance after the surgery is done. So these are the various aspects of cylindrical power from childhood to adolescence to adulthood, and the ways in which you can treat them. If you have any more doubts or questions regarding this complex topic, we have tried to summarize in a very short video. But if you have any more doubts, please write to us and we will get back to you with more such videos. Thank you.